Bhatt, welcome. You are the Chief Medical Officer of Sovereign Health, essentially the head of the clinical programming, and also lead many of our outreach efforts. What do you think distinguishes Sovereign from the rest of the treatment centers and the rest of the organization that you have worked in the past?
For me, the most important part is that Sovereign doesn't attempt to acquire other products and then call them their own. Sovereign has a brand, Sovereign has a mechanism, Sovereign has a methodology. And when Sovereign has attempted to expand and it has grown from a very small one-site facility and now has 9 sites across the nation, it's done with a model that can be reproduced. I think as a clinician, as a practitioner, as a physician, an essential part of treating somebody is the reproducibility of the treatment that you provide, because reproducibility is equivalent to reliability. And so for us, if we are going to be taking the care of somebody's loved one in our own hands, we want to ensure that our treatment is reliable.
Sovereign has, as you said, grown from being somewhat of a smaller organization to being a national behavioral health system. Mm-hmm. Obviously, there are challenges in quality when you grow from one small site to a larger organization. Any thoughts on how you maintain that quality? So if I'm a parent, I'm sending my loved one to Florida versus San Clemente or Arizona, how can I be assured that they're going to get the same high quality treatment at any of these sites?
I think internally, one of the things is important is that Sovereign maintains standardizations of practice. And one of the things that is crucial is that we attain and maintain standards of practice that are recognized by other larger organizations, academic organizations, and accreditation bodies. For example, if we're dealing in substance abuse issues, we want to follow protocols that are established by the American Society of Addiction Medicine. The same way, if we are providing psychological treatments, we want to ensure that our psychologists follow practice parameters that the American Psychological Association, for example, would endorse. So that type of standardization and that type of reproducibility using measurement-based outcomes and certain scales and ensure internal training occurs, that each one of the sites is doing the same thing or in a similar thing. Obviously, it would be tailored to the patient in its own unique way, but we want to ensure that the treatment is somewhat standardized, following those evidence-based or standardized practice parameters that are well accepted in the medical community. In terms of speaking of how a loved one would know, that's where communication takes place. And it's essential that whoever it is, the primary clinician or the physician or the therapist or even somebody within the house or the residence where somebody's living, as long as appropriate communication from the multidisciplinary team gets communicated, I think that's a huge important part of that exchange of information to make sure that somebody's loved one knows how they're benefiting from the treatment that they're in.
It is often said that Sovereign offers a higher standard of care, even though the licensing is of the same standard. So it's identical licensing, yet a lot of referrals come to Sovereign from other treatment centers or as referrals from patients discharged from hospitals who are quite unwell and who are quite challenging. Why is there a feeling that Sovereign offers this higher level of care even though the licensing is identical?
Although there's the potential to probably achieve that licensure, attain that licensure amongst a variety of treatment centers, not everybody actually uses that licensure, and that I think is a key difference. So, for example, when it comes to psychiatric behavioral health from its acute standpoint, we know in the United States, and multiple studies and evidence shows, there's quite a breakdown between somebody who's living in the hospital and getting treatment in the hospital, and when they ultimately get discharged. Those of us that deal in real life when we're dealing with treating individuals, there are certain limitations that have to do with insurance companies, that have to do with the patient's adherence to treatment, family involvement. And we often know that when they get sent to a hospital, maybe when they're in their most acute phase or most serious phase, there's a lot of pressures imposed on those hospitals to discharge them immediately or very quickly after short stays. And the unfortunate part with that, for that is that the families, the loved ones who are taking care of those individuals, they're not often prepared. They're not ready. They're not even had enough respite to even feel energized to go ahead and take on that often challenging part of care. And that's where Sovereign fills that gap. And being that other treatment facilities often only utilize mainly the substance abuse portion of their licensure, for example, and don't want to take on that challenge that is often seen as it's very difficult and it takes a lot of time, a lot of resources, a lot of expertise. And that's where Sovereign is willing to step up and has stepped up. And it's evidenced by getting multiple referrals from the hospital systems and multiple referrals from other treatment centers.
Recently at a conference, I asked somebody, when I say the word sovereign health, what springs to your mind? They said mental health. And Sovereign has decided that it would seek mental health licenses for all its sites where it is appropriate, and there is a state licensure that is available. Can you tell us why have a mental health license, and how does it assist in treating such patients?
Well, it's very important to attain or obtain any licensure that governs a type of treatment in any state. So if there's a licensure that's available that is the regulatory body, or that one that asks for you to adhere to a certain standard of excellence or criteria that has been established to practice a certain type of care in one state, it's important that we seek that out, and that's what Sovereign has attempted to do. So I'm proud of the fact that we are recognized for our ability to take care of those people within the mental health illness realm, because it's important, especially because there is a under providing, if I could use that term, or under-resourced. This is under-resourced area. Also, we found that as we've expanded, that many of the states don't even have such licensure in existence, that they themselves find themselves confused, or admitting, and admitting not in a negative way, but them understanding that, wow, we are missing even a certain level of licensure that is not encouraging or for the existence of a certain type of treatment. So in one way, yes, we do obtain that licensure in those states that exist, but by us searching this out, it reflectively allows the state to look into itself and say, wait a minute, are we missing something here?
So for example, Texas doesn't have, as far as one knows, that they don't have a residential mental health licensure, whereas Arizona does, Florida does, California does. This is something that you've come across in your, in your travels and your talks with the different regulatory agencies?
Yeah, in my dialogue with these agencies, I have found out that many of them felt this was a foreign entity or a foreign type of vision, that this niche wasn't filled. And they're actually very open. One of the things that many of them in many states, and I don't want to hold that state out in particular, but many states, they have said, well, thank you. You know what, we're willing to work together. We're willing to collaborate with you and create some sort of fused vision of this gap. And you know what, thank you for, bringing this to our attention. So yes, it has been my experiences that there are many states that lack this type of level of care and licensure.
Most other organizations that are present in multiple states don't have the kind of leadership that Sovereign has. Sovereign has a chief medical officer in you, a chief clinical officer, and a chief scientific officer. Why?
Well, it's very important that we address all bases, if you could say that, when it comes to comprehensive care. One is, looking at, in the sense that treatment often in the United States, especially in this niche, is somewhat divided into medical practitioners, and we call those that are the non-medical practitioners often clinical people, therapists, clinicians. So, for us, it's very important that we have oversight. So having a chief clinical officer and a chief medical officer helps us unite that bridge. This dichotomy, which I don't really like, has existed because many treatment facilities don't necessarily have a lot of physician presence and don't have a lot of medical presence, and they've been able to treat a lot of people in bulk. And we've tried to step away from that model by bringing on more people from both disciplines. At the same time, while each one of those can head up their teams respectively, our scientific officer is looking at our current state-of-the-art available knowledge that's there within the scientific community. Dr. Kumari, who happens to be our chief scientific officer, she holds numerous international awards and has done tremendous research when it comes to behavioral health. So for her, her being part of Sovereign, it helps us keep ourselves not only at a certain level of scientific and medical excellence, but also looking into the future so we can be ahead of the game going forward.
The treatment of substance use disorders has been fragmented. You mentioned this a little bit in the beginning, that you have the physicians, they come, they see the patients, they write their meds, and they go off. Then you have the therapist of a variety of caliber, from PhDs to people who may be just recovery coaches and with all good intentions. They're providing therapy or treatment, and there is a disconnect between the two. At Sovereign, what are you doing to have a holistic system of care and to complete that circle so that the medical part of it doesn't stay away from is not divorced from the clinical part?
For us at Sovereign, it's very important that we stick to the premise of the multidisciplinary treatment team. We understand, and most people would agree, that you cannot treat anybody with a behavioral health illness in one modality. There are psychological, social, medical, ecological influences that play a part in the evolution of somebody's disease. So simultaneously, or similarly, there are many experts that can address each one of those issues. So for us at Sovereign, we do ensure that our sites and our facilities and our patients are ultimately treated by a group, a team that encompasses the biomedical part, the psychological part, the social part. So each part of that human being's life is being addressed. And how is it being addressed? In a multidisciplinary treatment team where each one of those providers or contributors can communicate on a regular basis, and that's very essential.
Dr. Bhatt, in concluding, what attracted you to Sovereign, and why do you continue to be at Sovereign?
For me, it's important that I'm stimulated as a human being in terms of seeking out new advancement when it comes to treating individuals. For me, I've always wanted to provide excellent patient care, and I've always wanted to be involved in replicating that. Sovereign, that's where Sovereign is. Sovereign's mission, Sovereign's goal is to never be satisfied where it's at. We agree that, in order to treat a patient, you need to constantly be challenging oneself as a treatment provider, and that constantly growing from there. And for me to stick with Sovereign means that I'm part of a team that's constantly challenging itself. Not saying that we're the best at anything or that we're perfect at everything. No, we're saying, we're willing to continue to learn and raise the bar and continue to be open to new standards of practice and be involved with setting that standard of practice. That's why I continue to stay and be part of the Sovereign team.
Dr. Ashish Bhatt, Chief Medical Officer of Sovereign Health, thank you for talking to us today.
Thank you.